Hello and welcome to eMedicore Patients Corner series. Today's discussion is on bladder stone removal cystolitholapaxy. Bladder stones or calculi are stones or buildups of materials in your urinary bladder. Bladder stones are most often caused by voiding problems, with incomplete emptying of the urine from the bladder. Minerals like calcium or magnesium in your concentrated and stagnant urine crystallize to form bladder stones. Voiding problems may be caused by conditions such as enlarged prostate or BPH, benign prostate hyperplasia, neurogenic bladder, bladder problems caused by nerve injury, or bladder diverticulum, outpouching of the bladder, and bladder suspension or lift procedures. Foreign bodies, such as Foley catheters or bladder tubes, forgotten urethral stents or stitches inside the bladder, may form a nidus, a center for stone formation inside the bladder. In developing countries, bladder stones in children may be caused by malnutrition. Bladder stones may cause urinating problems, which include frequent urination, urgent urination, start and stop urination, difficulty in starting the stream, as well as pain in the lower abdomen, pain in the penis, bladder infection, and blood in the urine. Bladder stones can be removed during a procedure called cystolitholapaxy. Your doctor inserts a cystoscope, a small telescope, through your urethra into your bladder. The doctor then uses mechanical instruments, or laser, to break the stone into small fragments and removes the pieces by flushing them out. The underlying causes of bladder stones should also be treated at the same time. Cystolitholapaxy can usually be done under general anesthesia, completely out, or spinal anesthesia, numbing from the waist down. It can also be done as an outpatient same-day procedure. Here is an image on the left showing a bladder stone and laser instrument. On the right, you can see a clip of the laser instrument destroying the bladder stone. Here is an image showing the stone fragments after the cystolitholapaxy. Complications from a cystolitholapaxy are not common. They include, but are not limited to, bleeding, infection, fever, injury, or tear in the bladder or urethra, and additional procedures or surgery may also be needed. Before the procedure, your doctor will perform a history and physical exam as well as order appropriate laboratory tests to make sure you are in good condition for the procedure. You should let your doctor know if you are or may be pregnant, have any allergies to medications or food such as seafood, or allergies to latex such as rubber. You should let your doctor know of all the medications you are taking, including over-the-counter medications. If you're taking blood thinners such as Coumadin, Plavix, aspirin, ibuprofen, or etc., ask your doctor when to stop taking these medications. If you have diabetes, you should ask your doctor if you stop taking diabetic medications on the day of the procedure. Normally, you can take other medications with a tiny sip of water. Generally, you cannot eat or drink anything with the exception of a tiny sip of water, at least 8 hours prior to the procedure. You should also arrange for transportation to and from the surgery center or the hospital. Call your doctor if you have a fever or a temperature greater than 101 degrees Fahrenheit. If you have shaking chills. If there is heavy bleeding, such as passing blood that is thick like ketchup. If you are in severe pain that is not controlled by the pain medications. If you have severe nausea or vomiting.
eMedicore, core medical education. For everyone.
From everywhere.
Forever free.